Thank you very much, Madam President. Through you to the Minority Leader and to my colleagues, the legislation before us is simple. By way of background, as many of us know, over the better part of the last decade in particular, we all, in every one of the districts that we represent, the communities that we live in, have dealt with the scourge that is opiate abuse. And we all have, I am sure, personal stories of constituents who have reached out to us, of lives that have been lost and lives that have been touched negatively by this addiction. One of the many ways to address both opiate and heroin abuse is through a treatment known as Suboxone or buprenorphine, or its shorter form known as bup. This treatment is in most cases, or in many cases at least, a positive one for those who avail themselves of it. However, as it has come onto the market and as more and more folks who have sought the more traditional form of the treatment, methadone treatment, and been unable to access it, we have seen more and more clinics making this drug available. In many cases, those clinics have been well run. However, where they haven't been well run, there has been serious issues around diversion. By way of background, in my hometown in Pittsfield and in Berkshire County writ large, we have a serious opiate abuse problem. It's something that the district attorney, the health system, our community-based organizations have all come together to try and work on. We actually found, by way of background research, that there were more prescriptions in Berkshire County than there were people living in Berkshire County. In Pittsfield in particular, we've had a Suboxone treatment clinic for some time, for well over 5 years. The Berkshire County Drug Task Force has never had any issue with Suboxone diversion from that program. However, several smaller clinics came in, opened up, unbeknownst to anyone in the community, and all of a sudden, the Berkshire County House of Correction, the Berkshire Drug Task Force, the Pittsfield Chief of Police said that the number one drug that they were seeing in crime scenes, in our schools, in the jail, outside of other treatment facilities, was Suboxone. They all said they knew there were people who were being helped by this drug, but they were scared by the amount of people that they saw the drug getting into their hands who weren't seeking it for treatment. So what this legislation seeks to do is give the Department of Public Health the limited authority to regulate the drug to avoid diversion, specifically to bring the drug into the continuum of care that our constituents need, to make sure it is accessible and available to those who need it as an option, and also make sure that those who are providing it in our community are providing it as part of that continuum of care, not simply to make money, not simply to run a business, but rather to make sure that those who deal with the disease that is addiction have access to a drug that has promise for some, but not all. So the legislation before us simply seeks to make sure that the Department of Public Health has a role in the process. The current law is such that all an individual needs to do is take a one-day training at the Drug Enforcement Agency to receive the counseling and license, and then they are able to dispense this drug. And recently, the federal government has increased from 30 to 100 the amount of patients that any one clinic under one license can serve. So it is the least that we can do to make sure that the Department of Public Health at least has some small oversight role, first and foremost to make sure that where and when it is needed, it is dispensed properly and safely. So I hope the legislation is adopted, and I look forward to working with my colleagues on any number of other steps that we can take. And it should be said that we are all owed a debt of gratitude, those of us who work on this issue, currently here in the Senate, to the chair of the Mental Health and Substance Abuse Committee, to Senator Flanagan, who has done so much as well, the senator from Fitchburg and Leominster. And I'd like to thank the senators who chair the Public Health Committee and the Healthcare Finance Committee for helping move this legislation along, and certainly you as well, Madam President, for your leadership on the issue. So I hope the legislation is adopted, and I hope it's one of many steps that we can all take working together to address the scourge that is opiate abuse and the disease of addiction.
Bill to third reading. Third reading of the bill.